So at the University of Tennessee Medical Center, physician engagement really is about ensuring that both the hospital and the medical staff are working hand in hand in a synchronized way to provide the best possible care to the patient with the most efficiency and effectiveness available. As we move forward into the future of healthcare, I think that the patients are expecting more. They're expecting higher quality, better safety, better service, and they're expecting the care to be delivered not only in a patient-centric way, but efficiently and effectively. And the only way you're going to be able to do that is to have an engaged and aligned medical staff. On our campus, we're structured in a center of excellence structure. We have 6 centers of excellence that are based on the needs of our patient population that we serve in our community. And we have engaged the medical staff to be leaders of those centers of excellence. We've engaged the medical staff to also be integrated leaders for the medical center as a whole. And in fact, they actually sit on our board of directors. By definition, we have to have at least 3 of our 15-member board be members of the active medical staff. So as you consider the evolution of our industry on the provider side, we have to learn how to standardize the work that we do and drive, as a result, better quality, better service, better outcomes more efficiently. And so we have adopted a strategy to develop and standardize, to develop pathways to standardize across centers of excellence the care delivered to patients for like patients. So these are multidisciplinary teams of physicians and other healthcare clinicians that come together and decide on common patients that present with a certain diagnosis, how to care for them across the entire episode of care, focusing first on what happens within the hospital. So the pathways will ultimately encompass the entire episode of care, no matter whether it starts in a physician's office and lands in a post-acute care environment or anything in between. So these are not physician-specific order sets. These are really focused on the needs of the patient. And as we develop these pathways, we start with actually redefining the workflow from the patient's perspective. And so we use our lean methodology. We do our current state and a future state. We eliminate all the non-value-added tasks, and then we use our electronic ordering system, our physician order entry system, to hardwire the pathways into them so that it's easy and it's electronic. Some of our pathways have been in place for 3 years now, and we have seen that they appear to be demonstrating a lowering of mortality, a lowering of complications, and our length of stay still shows some opportunity for improvement, but our readmissions have dropped dramatically as well. We are on the Baldrige journey. We're well into it. We are a magnet hospital. We have applied for the Tennessee Center for Performance Excellence, which is nothing more than Baldrige, but the state's version of it. To me, it's about the culture that we're trying to build. Baldrige offers a wonderful framework to drive quality, drive service, drive efficiency and effectiveness, but even more than that, it drives alignment with all the key constituents that are involved in the care of a patient. And it transcends any individual or any individual strategy. It really is about the organization, and it should be a sustainable model.